It's Manifesto week here at the PLMR office, and we are going to do a quick rundown of the main parts of the Conservative, Labour and Lib Dem manifestos and what they're going to do for the social care system. Now, this is a huge priority for the country and something that needs to be a priority in this election, not least solving the long-term funding issues that are inherent in the system and making sure that people who need care are able to access high quality care. Now, anyone who's watched my videos in the past will know that I've stood here every budget, every autumn statement and said, oh, there's no more money or there's not enough money. This time it's very different. We've got three very different visions for how the social care system should run and should be funded in the future. So we're going to have a quick look at that, starting with the Conservatives. Now, they are pledging to quadruple the threshold from £23,000 to around £100,000, and that's the point that you will always be left with. So under that value, you will have to, you'll be funded by the state. Over £100,000 of assets, you will be self-funding your care. For the first time, the value of your house will count towards that threshold if you're in receipt of domiciliary care, so receiving care in your own home. They're also going to means test the winter fuel allowance, meaning that richer pensioners will no longer receive that benefit, with any freed up money being diverted into the social care system as well. Now, this is a very bold vision for how the system should be funded and very much places the onus on the individual and on their own wealth. For many people in receipt of domiciliary care, this is going to be a huge shock when they see their bills skyrocket. Many people have to start self-funding their own care as their house, which is most people's largest asset, will suddenly be counted towards that funding threshold. Many people might think that's quite unfair because actually you're still living in your house, you've still got your bills to pay, you've still got to pay the upkeep on that property, but all of a sudden you're also using that the capital value of that to fund the care you're receiving at home. I think many people find that quite surprising, quite shocking. And it's very interesting actually to see that the right-wing press, the Daily Mail in particular, are actually very supportive of such a move, even though it's actually their readers and the people, the traditional middle class, middle England, the people that May has traditionally appealed to, who will be most impacted by this change and having to use their house to fund their own care. Conversely, for people who are living in care homes, many of them will no longer need to, or some of them will no longer need to fund their own care as they'll be below that £100,000 threshold. For care providers though, on the whole, many more people will be self-funding. This brings up the importance, or underlines the importance of the current Competitions and Markets Authority investigation, and also the need for care providers to kind of justify the value of the fees they're charging. There's also a challenge where for the people who are currently in care homes and are no longer going to be self-funding because they're now fallen below the threshold, councils have to pick up that money and paying those fees. Will they have enough money to pay for those fees? Will they be able to match the funding that the care providers were previously receiving from the private individual? Or will those fees reduce and come back to the level that local authorities are often paying, which is far below actually the fair cost of a care package? So one of the issues that this raises is with more domiciliary care recipients self-funding and fewer care home residents being funded self-funding, will the two balance out? Will the impact this has on local authority budgets balance out? Someone's going to have to do some very hard number crunching on that to see, will councils actually be able to afford to pay particularly care home providers more money to meet the fair cost of care, something they've not been doing for a long time and is very challenging in a lot of areas in the country. Similarly, will the money that those councils receive from the means testing of the winter fuel allowance and the money freed up there, will that actually be used for to increase social care budgets? Now, obviously, social care is the largest part of any council's budget. With the precept and with the Better Care Fund, what we've seen is councils have used those ring-fenced funds for social care, but have actually, in some cases, reduced the unrestricted part of their budget so that there's no overall yearly net gain or net increase in the money they're spending on social care. Now, the money coming from the winter fuel allowance will be ring-fenced, but that doesn't mean that they can't just reduce the unrestricted part of their budget they're using now, therefore not increasing the overall pot of money they're spending on care, not least because councils have a lot of cost pressures across all of the areas they're responsible for. Now, moving on, we also have to consider the fact that there's the inherent unfairness, some will say, with this policy, that if you are an 80-year-old individual pensioner living in your own home and you receive a cancer diagnosis or a heart disease diagnosis, you will be, all of your care, all of your medical treatment will be with the NHS, it will be fully funded. If you receive a dementia diagnosis, you are now having to pay tens, possibly hundreds of thousands of pounds of your own money for that care. Now, there is a question there about, where is the fair price what is the fairness in that? Who should fund care? Is dementia any different to cancer? I think this is going to become increasingly important over the coming years, not least as the population continues to age, but also because last year, for the first time ever, more people died from Alzheimer's and dementia-related illnesses than died from cancer. So much more people will be affected by suffering from dementia and really questioning, why am I paying for all of this care when for years I've been promised free care within the NHS, and if I'd had a different type of diagnosis, it would be free. And finally, there's obviously the issue that this is very much a different proposal to what was previously accepted. The Deal Not reforms were previously accepted by all the parties, and indeed May's predecessor, Cameron, had started the process of implementing that, though postponed it until 2020 on the care cap of how much you'd spend as an individual. That's now gone out the window, so there's no cap on how much you'll spend. There's no pooled risk, and therefore many people will still suffer from the anxiety, the worry, the fear of whether they will spend all of their life savings and their, on care. Now, again, some people will say, well, why should they have that money to pass on in inheritance? Why shouldn't they pay for their own care? That's that is a certain debate to be had there. But the key thing is it doesn't allow individuals to plan. It doesn't allow, say, private insurance products to enter the market, which would allow you to, if someone my age, to start funding and paying into that now, so that if I had a long-term dementia care cost in my elder years, that would be paid for an insurance product. That's not going to happen with uncapped care costs. And so that's something that the Tories actually have really moved away from what was previously a cross-party agreed way to reform the care system. So a lot of potential changes here, a lot of upheaval. Some good, some bad, and I'm sure the debate will rage about whether this is the best way to fund care for the long term. But it is certainly a very bold and very honest, very, very honest approach to care, and saying that actually as an individual you should use your own wealth to pay for your own care, and that's the Conservatives' stance now. So the Labour Party and what Jeremy Corbyn and his team have got proposed for social care. Now, they've always been the party of the NHS. It's something that the polls always show they lead on and that the public trust them on. So what they have to offer here, particularly when Jeremy Corbyn talks so much about this being a crisis in the social care system, is actually very important. And their policy is quite simple. It's to put £8 billion of additional funding into the social care system over the lifetime of the next Parliament. Now that's a significant amount more money than was proposed by previous governments, and is much more than the kind of £2 billion odd shortfall that's predicted over the next 3 or so years. So really that is going to be enough money to kind of fund the system as it stands. They're also suggesting that the ethical care charter should be implemented and enforced on all councils and all providers. So that's basically the ending of 15-minute care visits, paying domiciliary care workers for travel time, making sure that care workers are paid a real living wage. All very wholesome, very good stuff there. Obviously, there's going to be quite a large cost implication to bringing those types of policies in. But again, there's £8 billion of extra funding being put into the system. That should be enough. But for the individual, there is no cap on what you're willing to, or what you'll have to spend on your own care. They're not going to change the threshold. So anyone with assets over £23,000 will have to fund their own care. It will be unlimited funding. So really this is a proposal targeted just at the poorest people in society, just those who are solely reliant on the state to pick up their care needs. There will be enough money in the system to fund those care needs. Care providers should be able to get the fair cost of care they've long campaigned for, long needed. The system should be stabilised. But for an individual, there's the risk of uncapped care costs and having to spend all of your money on care remains. Again, nothing to address the fact that it's, some would say unfair, that if an 80-year-old person has a dementia diagnosis, they got to pay for everything themselves. Cancer diagnosis, it's free. That unfairness has not been addressed either. And those are the biggest issues that remain outstanding with the Labour policy. Now, aside from the £8 billion, they are also looking to introduce a national care service. Now, very much tying in with Corbyn's themes of nationalising various industries, national education service. Now there's going to be a national care service. It will have £3 billion a year of funding. But, crucially, the manifesto says that they will need to seek cross-party consensus on where this £3 billion should come from. So the Labour manifesto as a whole contains loads of tax and spend policies. Anyone over earning over £80,000 in this country is going to, see their tax bill go up. Corporations will see their tax bill go up. There's going to be a lot of taxing. But even with all of that, the National Care Service, Labour's kind of flagship long-term solution to social care in this country, remains unfunded. They just say it's going to have £3 billion a year. It's going to be aiming to work in partnership with the NHS, integrate services a lot more closely, and kind of aim to drive up care standards. Now, this is all very good, again, but there's a very big question mark about where's that money coming from and how will this work in practice? How will yet another agency work with the NHS? How will the two cooperate to ensure that there is, as well as cooperating with local authorities, ensure that there is, true integration of health and social care, ensuring that things like bed blocking are not going to be an issue moving forward. Obviously, there is one place where Labour can look to learn from any hiccups that could be, that this system could bring in, and that's Manchester. Andy Burnham obviously won the Metro Mayor race there, and Manchester has, Dive Mank. They are in control of their entire health and care budget, and it's one large pot to cover the whole of Greater Manchester area. So, Andy Burnham and what he does in Manchester could well be a model for Labour's National Care Service. But of course, the polls suggest that this will never see the light of day anyway. So, we'll have to wait to see whether Andy Burnham can make a success of that type of model in Manchester. Maybe that's a lesson the country as a whole could learn. So now let's look at the Liberal Democrats and what Tim Farron and co have in store for the social care system. Now, they have long campaigned, very vocally through Norman Lamb, that deal nut should be introduced, and so it comes as no surprise that one of the things they're going to do is to cap care costs, finalise bringing in that deal nut proposal. That's going to be great relief to many people who have to fund their own care. But it does bode the question of, where will the money come from now that the state will be picking up the care fees for many more people? Firstly, there's going to be a penny on income tax, as Tim Farron says, which in reality is actually a 1% increase in income tax for everyone. That's going to be hundreds of pounds on everyone's bill, but it will raise about £6 billion. Now, that's going to be spent ring-fenced purely for health and social care. So there's a lot to cover with that, because they've got a lot of commitments on the mental health side, which will likely be quite expensive. Now, moving on into the term of the government, they would look to bring in a health and care tax, something that kind of is linked to your national insurance payments and is linked to that model, possibly drawing on both individual and employer contributions. That's going to have to raise a lot of money if they're going to, again, continue funding the system as it stands. Put the money there that it's needed, and to fill in the black hole that the care cap will cause. Now, to try and get the government off, having to suddenly bring in a tax bombshell, say, they also want to introduce an independent assessor who office, so like the Office of Budget Responsibility, but actually specifically for health, to say how much money does the health service need now and into the future. They will then put a recommendation of the money that should be put there, and then the government can say, well, look, we've got to fund it based on what the independent advice is for funding. And finally, they're also doing a very interesting thing, which is to bring in a register, basically, for care workers to ensure that people are meeting the right standards. Now, that's very similar to the system that operates in Scotland, but very new for down here, and should help improve the quality of care on offer in the country. Okay, so that's the top lines on the three main party manifestos and social care, what they're going to do. Obviously, the polls suggest that Theresa May and the Conservatives are on for a very, very large majority, maybe 150 seat majority, and should be able to bring in that potentially quite bold but also potentially controversial policy of ensuring that you have to fund your own care basically until you hit that £100,000 threshold. Now, there's going to be lots more news and analysis on this on the PLMR website, which is plmr.co.uk, and I'll be writing for elsewhere with my views. But if you want to get in touch about how any of these manifesto commitments on what the Conservative policy might mean for your business and your care business, please do get in touch.